Okay, so thank you for being here with us on a Sunday. This is Amy,
And Melissa,
and we're the Dyslexia
Dyslexia Duo.
Duo. So today we have with us a very special guest. We have Dr. Lisa Bowers, and she is going to introduce herself to our audience and explain a little bit about who she is, what she does, and everything about Dr. Bowers. So take it away.
Hi, thanks, guys. It's so nice to finally virtually meet you after a lot of back and forth. And just, I feel like I know you guys a little bit just from listening to your podcast. I've really enjoyed your previous guests, many who are really influential figures in the field of dyslexia and scholars I hold in high esteem. So I just really appreciate this opportunity. So a little bit about myself. I am a speech language pathologist by training. So I am an associate professor currently at the University of Arkansas. I teach undergraduate and graduate courses related to language and literacy in communication sciences and disorders. I also serve as director of Service Learning Initiative at the University of Arkansas. And in that role, I support faculty from all academic units on campus, students, and community partners. And we formalize and expand the service learning opportunities. So I'm a big believer in experiential learning and supporting our community through that learning process. And then I also serve as chair of the Interprofessional Education and Practice Committee. And that's through our national organization, the Council of Academic Programs in Communication Sciences and Disorders, which usually we just refer to as CAPSID. So that's been a really unique opportunity to learn from others from many programs throughout the country that are also committed to fostering growth and implementation of interprofessional activities. So advancing that collaboration in healthcare, which is where we usually see IPE and where I'm at in educational settings. So focusing on K-12 specifically in my area of interest and love, which is literacy. So thanks so much, guys,
Oh,
for having me here.
Wow, you're a
that's
busy lady.
It's all coordinated, right? We like these words, coordinated, collaborating.
no, it's great. It's perfect. So what led you to your current career, or maybe another career led you to this current place?
Yeah, sure. So I was thinking about that question. So after I graduated with my master's in communication sciences and disorders, I was a school-based SLP. So I always knew I
Mm,
wanted to work with kids. I love the schools. My mom is an educator. My stepmom's an
mm.
educator. My sister works in the schools. And so I've just always loved that school setting. And my training, of course, prepared me for the school setting to treat speech and language disorders, working with IEPs, directly supporting students in that school setting. But early on, I really noticed this critical gap where many of the professionals in the school had kind of a limited understanding of who the speech language pathologist was and what our expertise and even what our role was. And I was really new. I was trying to figure out what that was as well. So I knew that was well trained to be an individual interventionist, but I just didn't know how to leverage the skills and the knowledge that I had with speech sound development, receptive and expressive language skills, and literacy to be part of a team in a school setting. And so that kind of gap in my knowledge and understanding led me to go back to get my PhD. And so my work there was really focused on language accessibility and literacy outcomes and working as a team with educators, specifically special education and deaf education at the time, and then later on elementary education. So a lot of my research has been focused on enhancing literacy outcomes and the overall health and well-being of individuals with oral and written language disorders, but through an interprofessional collaborative process with educators and other professionals in the school.
That
That
sounds like a
sounds,
really
yeah.
brilliant collaboration.
That's what I was just thinking. It sounded really interesting too.
Yeah, so we have so the Interprofessional of Education Collaborative, IPEC, has 4 competencies that they've had for a long time that are really well established in medical fields, particularly with physicians and residencies, and even in our own work with occupational therapy and physical therapy. It's just not as utilized in educational settings. So a lot of those soft skills that are kind of implicit, we really haven't been explicitly trained or taught. How do we communicate effectively with teachers? How do we define our role and responsibility? And this is our expertise, but also, when we'll talk about this a little bit later, I think some flexibility in that so that we are coordinating those efforts instead of, being so focused on staying in our lane. And so we're really working almost more in isolation than collaboratively. So I just think there's so many things we can be doing to coordinate and extend those efforts. And I just didn't have the knowledge or really skill set. I didn't feel like when I graduated to do that, even though I knew how to do my role, I did not know how to coordinate, extend my expertise to support both students and my colleagues in a really efficient and effective way.
Yeah, I think that kind of leads me to think about, on the flip side, for me personally, as a professional, I feel like I don't know very much about the different causes for speech delays and what would trigger somebody to even get the identification, even from an early age, and how that plays a role in literacy. And I know we're going to talk more about that later, but can you explain to me a little bit more about the causes for speech delays? Because I think there are probably other educators out there that might need to know that as well.
Oh yeah, I love that question. Particularly because your podcast focuses on literacy and reading difficulties,
Mhm.
which are always typically associated with school age children and adults. But there is growing evidence to support that early speech and language development is also closely linked to those later literacy outcomes. And I teach the early intervention course in our program of study, and so we really dive into some of those links and what that medical history and case history of early childhood development it really does have an impact in what we're seeing later in the academic setting. So, from a speech pathologist perspective, we do cover the lifespan. So you'll find SLPs in the NICU working on feeding and swallowing, and also working with um, families with newborns and infants with genetic or congenital conditions, premature birth, so neurological conditions. So whether those are identified at birth or later on, like cerebral palsy or seizure disorders. So we're oftentimes in those medical either inpatient or outpatient facilities in those discussions with those more medically fragile infants and young children. Also hearing loss. So we work with kids who are deaf and hard of hearing. And then also come in, a little bit farther along developmental delays that are showing up in speech and language, but also motor. So we coordinate efforts a lot of times with other professionals too, because it's not really clear with a 18-month-old or a 2-year-old, is that a language delay or are they just a late talker? And there's that wide range of variability in early speech and language skills. A lot of times with autism spectrum disorders, SLPs will also be in those conversations as well. And those are happening birth to 5 before we get into the school setting. So oral motor challenges too. So we'll talk about articulation disorders, phonological processing disorders. So as kids are reaching those ages of 3, 4, and 5, they are becoming little adults with their communication abilities. And we think it's really fun. And you see the clips of kids that sound like an adult and look very young, but intelligibility, and when they are establishing those articulation milestones, a lot of times the SLP will be in those conversations as well. And more, we're getting a lot of referrals too for social factors. And so how we're working with collaborative practices in the preschool setting with our peers. Sometimes we're working with the behavioral specialist as well, trying to get some functional communication so that we can improve those behavioral outcomes. So we're really involved, SLPs, in that birth to 5. And again, a lot of those disorders or delays are going to have an impact in their progress when they reach that school setting as well.
You
It's
know,
kind of
I could,
interesting. Oh, sorry.
it's all right. Go ahead. Go ahead.
Our brains are both going, Amy. I was thinking about Dr. Gabb's research of how she's talking about how dyslexia, they're thinking that you can even see changes in utero. And it makes me wonder too, if you could see those, some of those changes or the difficulties with the speech language development at the early age. Is that kind of like an integration difficulty that maybe that the brain just isn't integrating all the sounds, and that might be, is that maybe a cause for some of the reading difficulties later, or is it kind of um the also the also factor? Do you have any input on that?
Yeah. So what I'm hearing is asking this question, there's a couple of things. One, speech language pathologists look at structure and function, right? So we have a lot of training in neurological development, what areas of the brain are developing when, and how we're taking in sensory information and then integrating that with motor planning. So when you think about a newborn, right, their first job is to eat, but that takes a lot of motor planning. So they're taking, they have reflexes that are assisting with that, with suck, swallow, breathe. But there's so much coordination that's going on between, we have to breathe, but we have to eat. And so there's a lot of motor planning that's happening just immediately with a newborn. That also, when you think about sensory motor integration, is also happening. They're taking in information, and their brain is taking in all of that information and becoming very efficient and effective at, okay, this is background noise. I'm going to filter that out because I can't listen or process all of that information. Here are the speech sounds that I'm hearing in my world. And by 9 months, they're already in tune with, this is my native language or languages. I'm interested in these speech sounds, and I'm not interested in the sounds of any other languages that I could have understood, but now I no longer know or no longer feel a need to pay attention to those sounds because they're taking in all of those patterns. So there is this loop of the information that's coming in, how the brain is processing that information. And then with that sensory information, they're then expressing it. And so that motor planning piece, there's definitely a feedback loop that how you're processing what you hear and what you're taking in is then going into how you're planning to express those sounds as it goes from babbling where they're just playing and a little bit more reflexive to then you get to some phonetically consistent forms. We're getting to our first word, and then we're able to establish that motor planning. So I've heard you say that word. It's very important to me as a 10, 11-month-old. I want that bottle. I want that water. I want that item. And now I know how to express that. And so I think, yes, we're seeing that all of this motor planning, it doesn't start with, while literacy is a learned skill because we created those arbitrary symbols that are written, and we're connecting that to our sounds that we've heard for so long. We have been planning those motor activities since birth, and really in utero as well. So I think that's where where we are, like, how far can we move this needle back to see when we are establishing these patterns? And that's what our brain is designed to do, is take those patterns and make them very efficient and effective. And so for our kids with dyslexia, we know we can get those patterns. It takes more explicit, it's a different type of learning, right? It's not, I even don't like the deficit model, right? In the human condition, it's just, it has to occur in a different way because that's what their brain understands in order to be able to produce those desired outcomes of being able to read efficiently and effectively.
That's fascinating. Thank you for your outlook. I'm sorry, Amy.
No, it's okay. It's okay because you asked a good deep question, and mine's just kind of more surfacey. Thinking back to my experience, I had been in public ed for 30 years, so I went to many an ARD in Texas for a while. It was Section 504, but many an ARD, and very seldom, unless the child with dyslexia was also, had articulation issues, did I run into the speech teacher in the ARD. It was, well, we call them ARDs here. Maybe IEP meeting might make more sense to everybody
Mhm.
else. But listening to you speak and hearing about all the different from basically utero to current age, how everything relates kind of leads me to our next question. How deeply is language and literacy tied together? Because I hear all this historical pieces that you're saying, and I'm like, why isn't this the SLP always involved in those meetings with our students?
That's such a great question, because I'm frequently advocating for the inclusion of speech language pathologists in literacy discussions. Um, and so I think about this question of how language and literacy are tied. I just don't see any difference. I think
Right.
any sort of arbitrary distinction is just that it's arbitrary. So I'm thinking about when my colleagues and I were writing our book. We wrote a book called Foundations of Language and Literacy, and it was very interprofessional. So I was there, elementary education. We had for every chapter, we have someone from a different perspective also contributing to the chapter. So English as second language, developmental child development specialists. And we spent a lot of time when writing that book thinking about the cover. And one of my co-authors, Carmen Bell, she led the creative efforts, and we were just incredibly fortunate to have her really share her time and talents as we were really thinking about, like, what do we want the visual representation of this work that we talked about and then actually came to fruition in the textbook. So it was really important that the cover reflect that book's core message. And what we landed on was it features a sapling that's growing in a field by a lake. And so just kind of starting out with your skills, but there's in the lake, there's a reflection of this fully grown tree.
Mhm.
And so there's these deep roots and a very strong trunk, and then these branches with really luscious leaves all over them. And to us, that was really a powerful image that language is the foundation of literacy. You don't have literacy without language. Um, so even if a child develops the decoding skills and they can be a fluent reader, and I think about one of my dear friends who's a specialist in reading in Korea, and she talks about, I could get you to decode Korean characters very easily because it's a one-to-one sound to character construction. She said, but you wouldn't have any clue what you were decoding, but I could teach you how to do that really easily. And, a lot of people know that, but you can become a fluent reader and still struggle with comprehension. So I just think we can't, this distinction between, particularly with SLPs, where the oral language and then literacy is over here. I think that's a really arbitrary and limited way to think about those skills, because I just don't see, you just don't have literacy without that foundation in language. And you can be a proficient in many oral languages without being literate, but you really can't be literate without having a strong foundation in language.
No, I agree with that completely. And hearkening back to something you had said earlier today, about how we should be working together more, but it's almost like we're in little silos sometimes and not crossing our paths together. Um, and I can think back when I'd be surprised to find out, oh, my student is also seeing the SLP next door to me. And we would have these conversations, or she would come in my room, and one of the curriculums we work with have the position of the mouth, what the mouth is doing when it says, and one's voice and unvoiced. And she's like, You do that too? I'm like, yeah, we're always looking at our mouth to see what the mouth is doing when we start to read, when we start to spell, because it's important because it's all linked together, and I was like, gosh, we should be collaborating more on our
Right.
students. So that's my thoughts.
That's right.
I mean, I could not agree more. And I see that all the time, that it is indirect, as you're kind of saying, or you just kind of happen on that information or proximity.
Hmm.
It's not, I would love to see it. My goal is, by the time I find the end of whatever my journey or path is, that it's not this indirect or just kind of happenstance, but it's intentional.
Yeah.
hmm hmm I think that's a great goal. I would love to see that happen more often. A lot of times I would get a student that they were looking at for dyslexia. They've already been in speech for, a number of years. And I'm thinking, well, this should be labeled as kind of a red flag. I feel if they're having some speech delays, that's a red flag that maybe something else is going on with their phonological processing, and we could be on alert, more alert for dyslexia that might be coming down the road. And then I think that's kind of where it leads me to my question. My next question is, why is articulation kind of always that flag for dyslexia? At least from my perspective as an educator, that's what I could see. I didn't know about all the other things that you guys address as SLPs. But I would notice the articulation and be like, oh, I wonder if that kid has dyslexia. What is that's causing that?
Well, just another great question that is sometimes overlooked. And I agree. I think coming down the pike, this should be, if there is concerns on articulation, intelligibility, phonological processing, which are nuanced difference, but definitely different. That really should be one of the first things that we're looking at as a red flag. Um, and when a child has consistent speech sound errors, right? That would be articulation. Then you're seeing this motor planning problem that I was talking about earlier. So there's something where the first thing we look for is hearing loss. So we always screen for hearing and vision before we do anything else in speech therapy. And so is there a hearing loss? Because there could be a conductive hearing loss, or there could have been some trauma or some etiology that was unknown. So just because they've passed the newborn hearing screening, or passed the screening when they were 5 in kindergarten, we always screen for hearing loss. Because if they can't hear the sounds, it's going to be really hard to produce them efficiently,
Yeah.
effectively, to the way that we would have that expectation.
Mhm.
So when a child has consistent speech sound errors, that motor planning problem, there's a weakness in that motor planning problem, possibly, or it could just be inconsistent access to hearing those sounds, whether they have a lot of ear infections. So if we have a long history of otitis media and we've had tubes 2 or 3 times, that's the first red flag, because they did not have access to those speech sounds. And so of course they're going to have maybe an inconsistent, or what we would consider incorrect production of that articulation sound. So when they're exhibiting articulation errors, that weakness somewhere in their ability to either hear the sound and or coordinate their muscles to effectively produce that sound, it makes sense that when you add in, again, these arbitrary written symbols, and so now they have this inconsistency in what they've heard and or how they interpreted that sound, and then how they're planning that motor planning part of how they're articulating that sound. Well, yeah, when you add in, here's the letter now we're going to match what you're hearing, what you're saying with this letter. It's just going to make that process for that student possibly more difficult. And it's not surprising to me that they would struggle with that task as well as it gets more difficult. Because really, language is acquired. We don't explicitly teach someone language. They pick it up in their environment. The brain's really effective at taking in those speech sound patterns, internalizing them, and then the motor planning and the motor processing piece. So if that's not occurring, yeah, it makes sense that Now we're at a learn task with these symbols. That's going to be harder too.
You know, we
That's
talk about a few times about how listening and speaking basically comes from immersion in your environment and listening to it, but reading and writing has to be explicitly taught, and that our brains haven't evolved to the point where we are naturally just exposed to reading and writing that we can pick it up. And I think that's just it made me think of that. I guess that's kind of where my stream of consciousness went with what you're saying. Our brains just haven't evolved to that point where we can pick up from listening and speaking and going into reading and writing. And then it made me think of some other things. So personally, as a child, I'm not dyslexic, but I had lots of ear infections and I was sent to a speech therapist. Okay, so this is back in the 70s, right? So it was some time ago because my last name would have just killed me as a child, honestly, with
yeah.
there's R's and TH's in them. But because I remember I had a hard time with R's and W's and TH's, right? So
Yeah.
that's pretty normal. But I was going into fourth grade talking like that. So that was not normal. And I remember starting speech therapy, and my teacher's name was Mrs. Abernathy. And I thought, oh my gosh. She goes, well, say my name. And I was like, Abernathy. And she goes, no. I was like, and I couldn't detect the difference between what she was saying and I was saying, you know, and I can see how that carries over into reading and spelling with that
Yes.
inability to detect especially the subtleties of watching what my mouth is doing and hearing what I'm doing at the same time. It's weird that I went into
Absolutely.
this profession, honestly.
It's so true that yes, and I started to talk about, but didn't really finish that thought. But that's where we start first is, can they distinguish the sounds, right? Can they distinguish two different categorical sounds? And then can they distinguish allophones with a substitution or omission or distortion? Did you hear the
Mhm,
same or different when I said work and walk? Was that same or different? And if they don't know,
mhm, mhm,
that's a problem. Like if we cannot hear these categorical differences and distinctions between phonemes or the allophones, and the allophones are, you know, that with co-articulation, right? We
mhm,
never really have that pure speech sound necessarily. So you start with isolation, and then you go to in coordinated speech, or you know, in the initial, medial, and final position, which is exactly what you as dyslexia therapists are going to be
yeah,
working with, only in the
yeah.
reading context.
Mhm, mhm.
If they can't do that orally, which is, as you said, our brains are wired to acquire language through immersion in our environment, how the heck are we going to expect them to be really proficient at doing that in a learned, much harder, more
Mhm,
difficult task? And so
mhm,
then we would start
Absolutely.
with that auditory bombardment of just providing them access to that sound in those different environments. And then we get to, are they stimulable? And that's what your teacher was trying to see. Are you stimulable for it? If they're stimulable for it, but it's not showing up in their co-articulated conversational speech, I'm a lot less worried. If I can say this word, and they say it back to me, I'm like, okay, so we're stimulable. We can produce it.
mhm,
Now we just have to work with a lot of practice and drill in these different initial, medial, final positions, and then more phrases, and then co-articulated sentences and discourse so that it'll generalize. We need to get to that motor planning. You have this incorrect pattern. Now we need to correct that with the motor planning. We just need to retrain your brain to be able to produce it in this way.
So
So
you're talking about
yeah,
more conversational, because if they can hear you say it, they can replicate it in a therapeutic setting, but when they go to conversational speech, they're lapsing back into. Okay, I get my oldest was in speech therapy too, and I remember because he did like initial S, he said it shh all the time, and I kept going, "What are you doing, buddy?" And so
right.
they dismissed him from fifth grade, and I was like, "Well, he still does that." And the speech therapist told me he can show me in therapy that he can identify that sound. She goes, "It's just a matter of time before it's important to him." I was like,
That's right. So if they can
"Okay."
have that skill, sometimes they get a little, you know, I mean, I'm from Delaware. You'd never know it from my accent now, but it's because I've been in the South for 20 years. But I go back to Delaware and my Northeast accent comes back. Um, But if I'm around people, I went to school at LSU in Louisiana. My dad was transferred. So when I'm in Louisiana, it becomes, my accent's a different thing. And so I can work on it, and I can, accent modification for myself in different environments. But my husband's the same way. When he goes back to Tennessee, there is a Tennessee drawl that is there that it's almost as we cross the border from Arkansas to Tennessee, it starts showing up. So it's similar to that, right? That if they can hear it, distinguish it, and say it in different contexts for us in the therapy setting, it's really up to them to generalize it. And I think sometimes it is how important it is in your peer group.
Yeah.
So do you think that the repetition through speech therapy would be advantageous to kind of be closer to mastery before they start getting introduced to this in, like, say, language therapy through somebody like a CALT? Or do you think it's best to do it at the same time?
That is a great question. And what I would say is I would want that to be coordinated efforts. No,
Mhm.
I don't want, I do not I would not advise that we have to have mastery in speech therapy before we would start with reading. And I think, we've talked, I think we'll talk a little bit about the spell to read approach too. It's kind of the same thing, right? You don't look for mastery in reading before you learn to spell, because spelling influences reading. And so
Right.
I think it's the same. What I would say is the same. And so what speech language pathologists, we have a lot of training. We definitely have an area of expertise, but it's not magic. And I'm not the only person who can work on S in the initial position that you were talking about, right? So
Mhm, mhm.
with just a little bit of training, and again, making sure it's coordinated and intentional, the speech therapist, can provide you, the CALTs, here's what we're doing, and here's what I'd love for you to support in your therapy setting.
Mhm,
And then vice versa. Tell me what you're working on, because I can support that
Mhm.
in what we're doing as well. And so that cross collaboration is just going to coordinate and extend versus, hey, I'm going to finish what I'm doing over here and then you can start. But it can get tricky if there are some differences, and that's where you really do have to collaborate and get on the same page and say, well, I'm seeing this a little bit differently. How can we? And you do have to come to a consensus. Otherwise, it's going to be confusing to the student. If
right.
I was thinking about what Amy was saying when the speech therapist came in and said, we work on this as well. Well, if I'm using one program and I'm using some set of how I'm talking about the articulators, what I've named um, the muscles of the mouth, right? So if we're thinking about teeth or the tongue and our lips, like there are programs out there that have these really cute and very functional ways of talking about these sounds. Well, if I'm using that set of language, and some other therapist that the same child is seeing is using some other different ways of describing the same motor planning processes that we're trying to get to, that's confusing.
Yeah.
And if you've got
Mhm.
a language deficit or disorder that's in the mix, then it's really confusing for them. So
Mhm.
again, just we're we are distinct. We don't have the same areas of expertise, and we wouldn't want to, because then what SLPs bring to the table wouldn't be as rich and expansive. And what CALTs bring is so important and valuable. SLPs, some are duly certified, and I know them, and they're amazing, but they're few and far between. We can't have every SLP also being a CALT, because then who's working on all those other disorders that we work on, right?
Yeah,
So we
right.
have to coordinate and extend so that you're thinking about the kid.
Yeah.
Mhm, mhm. I love that. I totally agree with you. And so then I guess what I would ask you next is, how can speech therapy and dyslexia therapy, how can they work together to benefit the child's improvement in both speech production and reading acquisition? I know you touched on that a little bit. So I would just ask a little bit further. Do speech therapists use a multisensory approach to instruction, kind of like what we do in our dyslexia therapy?
Yeah. So I love this question. I think it is nuanced. So in our field, we have standards. So when you enter into a master's program for speech language pathology, we have what we call the big 9 areas. So receptive and expressive language and literacy are one of those. Cognitive communication, fluency, and by fluency, we're talking about people who stutter, not necessarily oral reading fluency. Um, and we are the lifespan. So we're birth to end of life. But a lot of our strategies, I mean, we came from BF Skinner, so we're behaviorists at the core of our field. So we are looking to modify behavior to improve communication outcomes, and that's oftentimes going to be multisensory. Now, I use the multisensory teaching of basic language skills that I know has been talked about on this program. And so my students have access to that. And I know a lot of different programs that, they have literacy in their curriculum, but they may or may not have a designated course like we do at the University of Arkansas. I think there was a study that showed about 35% of graduate programs have a designated course on language and literacy, and they may or may not be using the same materials I am. So I know that's what my students are being exposed to. Again, because I believe in that. I don't think that all of our textbooks should be written by SLPs for our field, right? I just think that that book might be a little too much for the SLP who's not going in the school, but it's going to become their core reference that I wish I had had going into a school-based setting. So yes, I think that a lot of the components of a multisensory approach to instruction, particularly when working with language and literacy, are being taught and have that training, but it's not as intense. I have gone through training, the academic training for COUT. And so a lot of the same principles, it's just not as intense. But a lot of the principles that they're teaching in different programming for sure are embedded within the course curriculum for SLPs. So I would say, I think the second part of your question was that collaboration piece. Is that right? Like how to collaborate. So I think, again, just being intentional, and that's what I would advocate for, is that the strategies that the SLP is using, again, like I said, they're not magic, they're not proprietary. Oftentimes, SLPs are sending home homework to parents. So where they're at, they're inviting, and I would hope supporting parents to also be part of that process as you're working on that motor planning. We can't do it in 30 minutes. That's just not, that's not going to happen. And so, but I think, again, if what we're doing is not being supported or is even in kind of contrasting what's going on when they're receiving services from the dyslexia interventionist, who, quite frankly, if it's being done right, the dosage that they're getting, right, the time that they're getting from a dyslexia interventionist, and certainly from their gen ed teacher, is far more than anything that we are going to be able to provide and support. So I think the most powerful part of an SLP's work sometimes in the school setting is that consultative model. Here's what you should be doing, and here's what you can do. And this is something that is a strategy you can work on initial S. I remember one teacher a long time ago when I was, kind of fumbling through this as a young SLP, she said, "But I teach math." And I said, "That means that you are smarter than me and also can help this fourth grader with his initial S to not be interdentalized," right? That's a very fancy way of saying, tell him, or just remind him, or give him the model when he says an interdentalized S, when he says think and he means sink. I didn't understand that. Did you mean sink? You can do that. That's not hard. And you're a math teacher, so I know you're smart. And that is not a strategy. But again, there was this, but that's not me. I'm this bucket. And I think Amy, you said,
Mm,
I'm in this silo. I'm the math teacher. And we just have to broaden that. I am not a math teacher, but you know what I am? I'm a language expert. And
mhm.
so give me those math word problems at the bottom of that worksheet that they do not want to do because they can do that math, that student, but they don't understand the language of the math word problems. And I can do those word problems and help them support through that process of understanding those the language in the math word problems, even though I'm not a math teacher. And I think we just have to continue broadening that perspective.
I agree. And I think that that kind of lets me think about my students as well, that I had mentioned in our questions about a student I have that has difficulty with vocalic R, and I'm working with her privately after school 1 day a week. And where I'm teaching her our combination ER sounds, and I'm so worried that I'm going to mess up what the speech teacher is doing to teach her vocalic R. And I'm like, but it's and I'm trying to show her, okay, look at your lips, they're puffing out, and then your mouth opens a little bit, then it closes, so I'm explaining it all to her. And I'm like, oh my gosh, I'm so nervous about what the speech teacher is going to think about what I'm doing. Is this right? How should I work with somebody like that if they are seeing a speech therapist? Like what could I do that would be beneficial for my students?
Oh, I love hearing you ask that. And it also kind of hurts me a little that you're carrying this worry of what if I'm messing it up?
Yeah.
Um, because my response would be I'd ask them. Right? I would ask the question or just say, could you add me to the email that you send to the parents so I can see the worksheet? Because I know
Okay.
you are a highly experienced, highly trained professional, and having that first like instinct of I don't want to mess this up is a wonderful one. And then if somebody asked you, hey, I don't want to mess up what you're doing as the dyslexia therapist. How can you help me? I know just from our interaction today, your first response would be like, absolutely, yes, this is what you can do. And I'm so glad you
Yeah.
asked that question. And so I think I would anticipate you have the same response from the SLP of, yeah, here's what I'm telling the parents to do. And or here, I'll send you, I mean, it's so easy, right? With technology, here's a video of the
Yeah.
strategy that I'm using. I'll text that to you.
Yeah, that's
And so
wonderful.
that's such
Okay.
an easy way, again, to just coordinate. Or if you don't want to do the strategy, you just show, can I show the student the video of you when it makes sense in what we're doing? Because I want to make sure they have that appropriate. And then you just show the video of the speech therapist. You don't have to be in the same room. You don't need an extra course on this. And I will just say too, vocalic art is the trickiest of all speech sounds, in my opinion, to master because when you think about what we talked about with motor planning, you can't see it. It's only in co-articulation, right? So you
Mhm,
can't even do it in isolation.
mhm.
And you hear it. And when you hear it, we as native listeners know it, but it's the most imprecise. And that's why
Mm.
there's so many R's. And that's why a lot of times they become like muddled, just this
Yeah.
right?
Mhm.
Because it's so hard. You can't do it in isolation. You can only do this in co-articulation. And so, and you can't see it. There's absolutely nothing to see. Then I will share with you, and we can share this, that there are some great resources too for feedback when you think about auditory bombardment. There's a lot of apps now that the student you can say your R and you can watch it. Like
Mm.
here's where you want to be in the mouth, and it'll show, front to back, top to bottom, kind of this space. Here's
Mhm.
where I am. And then they can say, look, well, here's where you are. You're neutralized right in the center. Can you get it to work? And they watch it. And that
Uh,
visual, again, multisensory, that watching what they're saying, they're visually seeing that they can move the needle to get to from work to work. It's fascinating. Some of them, that's all that they need. They need that visual representation of what they are saying. And then all of a sudden that connects to, oh, and here's that R rounded. I mean, we think our symbols are
Yeah,
arbitrary.
yeah,
I love that. It's so fascinating. And
yeah.
Dr. Shaywich's book goes into that about our symbols are actually not as arbitrary as we think they are, right? That they visually sometimes look like the sound that we are expressing too.
Yeah, that is fascinating.
That's wow.
So I
Okay,
hope you reach
goodness.
out to that speech therapist.
Yes, I will. Thank you for that.
That's just such an easy, again, connection. And to make you feel peace of mind and confident in what I'm doing is coordinating, not conflicting with this other professional
Right.
that they're seeing.
Right. And
Yeah.
I think that's the fear that we all have because as CALTs, as dyslexia therapists, a lot of us are, we're trained in Orton Gillingham methodologies, but a lot of us in Texas are using dyslexia curricula. And we've been told, if you've got a student that you're seeing after hours, you need to provide the same curricula to avoid conflict or confusion with that student. And I think that's the fear that we all kind of walk with is, oh my gosh, I don't want to mess this child up any further with what I'm doing, and I think that's a concern that we all have. But going back to good fit educators, you had talked about, of course, CALTs and SLPs, they work together well, or dyslexia teachers and SLPs work together well. You even talked a little bit about the math teacher can do a little work with the word problems. What would be some ideas of some really good fit teachers, educators who could work with the SLPs?
I love that question. So I'm going to back that up to give a little bit of context to what I talked about, some terms, interprofessional education and interprofessional practice that I hope
Mhm.
become a little bit more normalized in the educational setting. So interprofessional practice is when professionals are coordinating efforts, they're learning with and from one another, and they're practicing using these skills of effective collaboration, teamwork, roles and responsibilities. I know my role, but I also know your role, and I know where we have shared understanding and again, how we can grow and extend from one another. And then values and ethics. I value you. And I think that kind of touches a little bit on what I have experienced and thought, where um, I should know more and I don't. And so that's what keeps me here. Like I need to keep this persona of I am a professional and I know what I'm doing. And I think that's sometimes why we don't share. We have this like, what if I'm doing it wrong? What if I learn
Right,
I've been doing it wrong? And I think we just have to, all of us collectively have some empathy and some understanding that we're all doing it kind of wrong. Because if we weren't, we hit the ceiling of we're doing it as to the best of the ability and we'll never be able to grow. Like that's just not reasonable. So I've just had to allow myself the freedom to say, I'm actually not doing it right. I'm doing it to the best of my ability with the knowledge and skills that I have. And so is everybody else. Um, and with interprofessional practice, when you work on that explicitly, you build that empathy and you build that space for vulnerability, which is where you get the coordination and extension. If you are not coming to that space vulnerable and humble and with this value of, I know what I bring to the table, I'm very confident in that. And also, I don't bring everything, but this
right.
person brings a lot. And that goes from experience to novice. I don't really feel comfortable. I've now been in the field like longer than I really want to say, but more than 20 years. And so I'm consider myself on the experience side. Um, I want a novice at the table. I want someone brand new because they bring something that's really very different to the table. You just don't want everyone. You don't want a table where everyone has 25 plus years experience
Yeah.
necessarily. Um, so that's what interprofessional practice is. Backing that up, interprofessional education is when that's happening when you're the pre-professional. And so to your question of who would be a good fit, here at the University of Arkansas, we're really lucky because of higher education is it's a whole little ecosystem on its own. And our field is everywhere. I was trained in in a College of Arts and Science. I got my PhD at the Health Science Center. Here, we're in the College of Education and Health Professions. And so it's really a magical fit for speech language pathologists. And within that structural fit, I work really closely with counselor education, special education, elementary education. And so we also have occupational therapy within my own department. So we're really lucky to have that here. And we have an administration that really supports that. And so my goal is to continue, like with our textbook that was interprofessional with our contributing authors. If we aren't at the pre-service level teaching these future professionals to value each other and that we're learning with and from each other here, it just seems so, I don't know. Again, if we're saying you need to value collaboration and you're looking into a sea of pre-service speech language pathologists and I'm the instructor, that's not really modeling collaboration. And so we're really making an effort to have these undergraduate courses. And some of this is because of our state guidelines for the science of reading. They have the same standards in special education and elementary education. So we're working to create opportunities to learn together so that when they get to their school and they are the second grade teacher, they've already had courses with special ed and speech path. So they know those professionals, they know those roles and responsibilities, and they'll feel more comfortable and confident creating those spaces of let's learn with and from one another. But those are really some of the key players. We also work with social work. They're so vital and important. Again, for thinking about holistic child outcomes.
Yeah.
But those are the ones that I have seen the value in really targeting specifically is special ed, elementary ed, and speech language pathology. There's too much overlap and connection, particularly with language and literacy, for us not to be coordinating our efforts as the instructors of record for our pre-service professionals. So they go with that foundation of, I'm going to seek out these people because I know they're there, versus we tell them they're there, but we don't really model how do you do that?
I'm thinking back to when I was pursuing my bachelor's back in the Wayback Machine. And it was just a bunch of elementary ed teachers with a reading endorsement that kind of went from class to class for the last couple of years. I didn't interact. Shoot, howdy. I'm telling you right now, I didn't even know what an SLP was until I got to a campus. I didn't know that they had them in school systems because I went to private school, so they had to bring in somebody for me to get my speech language, my articulation piece worked through. So I think that could be a vital, important piece that they start to bring into those pre-service teachers.
Yeah, because think about, just in your experience you shared, how long did it take you to think about, okay, now I need to know who she is. Now I feel a little vulnerable because I didn't know that the speech therapist would be in this setting. Ooh, why didn't I know that? Is that something about me? Okay, so what exactly do they do? Can I ask them, or does that show that I don't know what they do? And so you've already set up this barrier that really isn't even there. It just, you weren't trained and you weren't provided those learning opportunities. And so the other part that we're trying to do here is coordinate those preceptors. So, I talked about service learning, and that's one of the pieces of service learning is I want to make those interprofessional. Everybody's doing internships. All of those professions are in counselors. They are in the schools for one of their rotations. Maybe they won't be a school-based counselor, but some of them are going to be. Same with speech therapists. So all of our speech therapy students in graduate school are going to internships and clinical practicums, as we call them, in a school setting. Where are the pre-service teachers? They're there too. Where are the special educators? Guess what? They're there too. And so we're really trying hard and had some success with coordinating some of those experiences. Sometimes we did an after-school programming We've done, they don't even meet, they weren't meeting together physically because of time constraints, but they were asynchronously communicating online and talking about their experiences because they had the same child just at different
Mhm.
days. And just that limited exposure and understanding was so powerful, the feedback
Mhm.
from those students. So I just feel really strongly that if we are not modeling for our students who are being trained to be the professionals in the schools, and one of the reasons they're leaving the educational setting, not the only reason, but one is feeling of belonging.
Mm-hmm.
So if you don't feel that because you have these barriers, how do you find your people? Well, maybe that shouldn't be a soft skill. Maybe that should be something that we are training. Here are your people.
Mm-hmm. No, I agree with that completely. I can remember as a dyslexia therapist feeling I'd call I was on an island. I felt like I was by myself on a campus and I shouldn't. I mean,
Good.
I had friends, but they weren't doing what I was doing. And it would looked very, very different.
Mhm. Well, and I think even that collaboration piece leads to better identifications as well, because
Oh,
Oh,
you're learning
yeah.
from each other. You know exactly what all the students, well, not all the students, but a lot of the students that are struggling, you will know, oh, this is what this looks like when it's dyslexia, or this is what a speech delay might look like. So all of that collaboration together as a team would really be improved if you had those types of relationships.
absolutely. I mean, I just
And
could not agree more.
I think that, that's what I've noticed in my career. There are challenges with the identification process of dyslexia. I think one of the challenges I've witnessed myself is that, one, of course, people don't know enough about dyslexia
Right.
even still, but two, the warning signs. And I know I talked a little bit about this earlier, but I think that with a speech delay being that, knowing that speech can be a phonological processing disorder as well, what are some of the things that you could say to teachers, some of those collaborators that we're looking at? What are some of the early warning signs, not even just teachers, but even counselors or principals, people that are actively involved in an IEP meeting, that are thinking about students on a daily basis, looking at them on charts, looking at their little reports? What are some early warning signs that a speech deficit may be indicative of a phonological processing disorder like dyslexia?
Yeah, we talked about articulation disorders, right? That they're really that
Mhm.
motor planning problem.
Right.
And I mentioned, but we haven't talked about, and this is a great place to kind of add that phonological processing are tied to articulation. And oftentimes, at least in our assessments, it can almost be phase one, phase two. So we look at the articulation in isolation. Do they have these sounds of the English language, or whatever language is being assessed, in initial, medial, final position? Then what's their overall intelligibility in discourse or conversation? And then we take that information and we overlay it, or in some assessments, or in another assessment, it's just a different procedural to see about the phonological processing disorders. And so they're they're connected, but the phonological processing disorder in our world, in order to have that diagnosis, is really when you see the rules of sound patterns, they have an error in the rule. And so this could be final consonant deletion. So they're
Mhm.
just deleting those final consonants. It's not just that they don't have F in the final position, but they don't have F, they don't have um, voiced fricative V. They don't have that one either. They don't have G in that final position, but they do in the initial. So that would be an example. And they're inconsistent, right? Depending on if it's initial, medial, or final. And so that's one of those hallmark characteristics of the phonological processing disorder. So I'm going to be a lot more worried about that phonological processing disorder when it becomes a sound pattern and it's broader than just one or two speech sounds, particularly the ones that Amy talked about that are really those hallmark ones that we see a lot, S and R. They're just two of the most difficult, and some of that's because of their saliency. Some of it is because, you know, what you can or cannot see. And then S is high frequency. So if they've had a lot of ear infections or maybe some conductive hearing loss, that's going to be one that is going to be a little bit less consistent, that they've had that sound and then that motor feedback. So I'm a lot more concerned when we're seeing a pattern than I am when we're seeing these articulation errors. So that's one thing that I would say. And I think if we can't establish those consistent patterns in their speech sound development, you can just, I mean, it doesn't take long before you're just, you know, looking down the road. And again, once you make this a much harder task by introducing that sound syllable correspondence and those orthographic patterns, it just becomes that much more difficult for those kids who don't have those sound patterns well established. So that's
Yeah, I think
definitely one place that I see is just low hanging fruit.
I wonder, you know, I hear all these kids that they talk so cutely, and they'll say, I had talked to a student recently and he said, well, my teacher's moving. And I said, well, to where is she moving? He said, well, she's moving to Iowa. And I was like, oh, I haven't heard of Iowa. And I said, is it Iowa? And he said, no, it's Iowa. And I was like, oh, okay. Well, that's an interesting sounding place. I wonder if she's going to like it there. You know, it just was so cute, but totally lacked all the ability to hear that I was saying Iowa. He was saying something completely different. And he was adamant that it was Iowa. I was wrong. He was right. And I just think it's very interesting to think about, you know, if I'm a classroom teacher, thinking about those different sounds that are just come from speech, that maybe that could be some things that they could think about too. You know, what are they saying? Are there mispronunciations that are kind of a red flag? Is that something that's pretty common too?
Yes. So I love your example. In our world, my daughter is 8 and she still says Pacifically, and I don't want to lose it. Like, it's going to be Pacific forever. We are always going to be very Pacific, and I don't want to lose that. And you see that sometimes too. That's a unique one because that seems like that was a word that was new, and he heard it once and that he internalized it that way and could not make that distinction. And so in that case, I get parents a lot, or at my age, it's a lot of my friends who have kids in that sweet spot of the age range where you're getting a little nervous. And I would equate that to, again, like reversal of letters, right? I'm sure that's the first thing that people say to you, like, well, it's supposed to be a B and they wrote a D. Did you
Yeah.
have dyslexia? And so
Yes.
we have to go through, like, yes, that is
Mhm.
an indicator. And also it's developmental too.
Developmentally appropriate. Yep.
Yeah.
And because they have an inconsistent representation that we then need to make consistent and explicitly distinguish between those two. And so for that kid, he heard it, it was new, he internalized it that way, and he didn't really, he wasn't really amenable at that moment for you to disrupt that internalization that he heard from his teacher. And Iowa probably isn't something he's heard or has any background knowledge, so there's nothing for him to, with that disruption in, is that the what it was? He probably hasn't seen many TV shows on Iowa or cousins in Iowa, and so there was nothing else in his background knowledge or in his linguistic context to think maybe I got that one wrong. So if it's in isolation like that, it's the same with the reversals. He internalized it and then it solidified that way, and that's how he is expressing it until he hears it, hopefully. But if you give him another word and the same thing happens, that's when I start getting the same with, if you've given that distinction between B and D and you've been very explicit, and now we have these two distinct letters, and
Mm-hmm.
you're still seeing it, okay, that when we've moved past the this is developmentally appropriate and we're seeing that this is, we cannot distinguish between these because there's an inconsistent pattern that we've developed either in what we're hearing, we can't distinguish, or what we're writing. then I start getting concerned. But it's the same thing in speech, right? We hear the same thing, and I'm never going to correct my daughter to say no, it's specifically because I want that one to live on.
Yeah.
Yeah.
We still say some of the cute things our son said, but he's
But
25, almost
I
25.
was
So
going to say we do it to our kids
yeah,
too, and they're,
yeah,
you heard me, chronologically adults.
yeah.
So they don't appreciate it. Let me just put it out there.
yeah.
But well, let's talk a little bit about some of your research about how spelling facilitates reading in the spell to read approach. What can you tell us about that?
Yeah, I love spelling. I get really kind of fired up when I see how little we spend time. When you look at research that shows we only spend, a very small percentage on time. When you hear people say that spelling is obsolete, it doesn't mean anything because we now have word processing and spell check. And um, I just, spelling is really a foundational um, skill that is reciprocal, just as language is reciprocal with literacy, and literacy doesn't happen without language. Spelling is really a skill that is also reciprocal with reading, and so that's kind of what the spell to read approach is really trying to demonstrate, is that spelling is a window into and one of the best windows we have really into being able to observe the linguistic processes, how that student is internalizing them. So decoding is great, encoding is great, but spelling is really showing us what that internal representation is to that student expressively. And so I think that it's a great diagnostic to look at what how are they processing what we're teaching them in the decoding process. And it's just fascinating to me that sometimes it doesn't get that interest or support from others. And a lot of my work in spelling, I should say, too, came years and years ago. As I said, I also worked with individuals with hearing loss, but I had this really unique opportunity when I was in my graduate program to work at a state school for the deaf with colleagues and collaborators in deaf education. And I was on the team to help them with the writing. They had personal narratives and expository text to analyze using software that we use in our field, but they didn't really have one that was kind of the similar. And so we were taking these writing samples and coding them using this system. And I was just gobsmacked, fascinated by the spelling of these students who were in 6th, 7th, and 8th grade, who all had hearing loss. And they were using what's called CWE, strategic and interactive writing instruction, throughout the year. And so we were looking at the progression of their writing skills, and they were so excited about the increase in higher level thinking. We were looking at just word usage and increase in function words and all of these different things. And they were just so excited about the writing outcomes. And I was just laser focused on spelling. Like, do you guys not see the spelling? And they didn't. And so going back to interprofessional
Wow.
education and practice, they didn't see it because they were so used to the spelling of deaf students, which I was not. And so in their wheelhouse, that was just kind of what spelling looked like. And for me, that is not what spelling looked like. And so we analyzed the spelling, and in fact, they were using very different linguistic strategies for how to spell. And they were using spelling that was not phonetically consistent. That's what we would typically see. As you guys know, in our developmental progression, we would see students who are spelling incorrectly, but it's phonologically representing all of the sounds. It's just not the right letters or the right orthographic patterns, right? And then from there, you're going to see those orthographic patterns really solidify, and this really developmental, again, progression, that we would see these orthographic patterns that they're able to use. And then you see how they're able to add morphemes and get to much complex spelling patterns. And so it was just fundamentally different with our kids who were deaf and hard of hearing. What they were using, they were using one letter to represent an entire word. Well, of course they were. Some of them were signing. And so one sign is a concept. So one letter was a concept to them.
Oh,
You do not
okay.
see that with typically developing kids,
Right.
or with typical kids with typical hearing, where they're going to put one letter. They don't do it. So they were using letters that were visually similar to the sign, right?
Yeah.
We also don't see that. So that's what kind of got me fascinated with this, again, window into how we spell can inform what we're using for instructional purposes when thinking about reading and decoding, and then vice versa. As we learn those patterns, we should eventually see them in our spelling. And a lot of it is the same as we think about receptive and expressive language, right? Our receptive language is usually better than our expressive language. But then as we express more, that increases our receptive language. The same thing with spelling. We're going to see a little bit of a lag, but we can use what they're writing to inform our strategies for reading.
Mm-hmm. Absolutely.
I just
Wow.
don't know why people don't think it's important. It's just,
Well,
yeah,
and I feel like there's a disassociation between reading and spelling, and what at least in some, not all classrooms, but in some, you have the kids, maybe they have this beautiful reading curriculum that they're using, it's OG based, but then they give them spelling lists that have nothing to do with anything, and it makes me a little crazy seeing
yeah,
that.
Or
yes, that is,
they send that list of words that are all of the ways you could spell O, or all the ways you could spell A, and it's got all the irregular patterns included in that. And it's,
Yeah.
oh,
I,
makes my brain hurt when I think about that for our dyslexic students, and they sit in classrooms like that where they get these spelling lists and then they have to try to practice that at home. It just makes my heart hurt for them. It makes my brain hurt for them because
yeah,
I know how difficult it is.
I can
that's even worse,
remember.
right?
Yeah,
Mm-hmm.
I can
Worse
remember
than,
when I was a classroom teacher and we were doing whole language and they were basing it on social studies. In my second graders, they gave us the list and one of the words was penguin and Antarctica. And I was like, how often is this coming up in what they need to know? I mean, this doesn't even make any sense.
yeah, that's even, I was going to say, that's even worse where I get kind of jazzed up when spelling is just, oh, that's a skill that we don't need anymore, that doesn't matter, or we don't have time. I mean, I understand time too. I'm not a classroom teacher by training, and now that I work with them, I have even more respect for how you get 30 little humans to look at you and sit in a chair, because I didn't
Mhm.
receive any training for that, and I don't know if training would have even helped. I don't know. You might have to have some sort of
Yeah.
something to work with. But so I understand that there's a lot and why they would get such a little time, but that's even worse when it's not even connected
Mhm.
to the reading curriculum or what's being taught for the reading, that it's then just so esoteric or completely out of
Mhm.
left field and not connected or tied. I don't even know what's worse. Like at that point, I might even say, maybe
Yeah.
it's better to not.
Yeah. Yes, I agree. I agree. And I know I have several students who come to see me privately and they bring their lists, and I've actually talked to the parents because now I'm in the private setting. You can't just go and talk to the teacher. You have to kind of talk through the parents. So I'll tell the parents my concerns. The parents will go and talk to the teacher. So then the teacher sends me what the words are, and I'm supposed to pick words that are more
Yeah.
accurate for their ability level, which it works out fine. But I still think this could be so much easier if there was just better instruction for classroom teachers overall.
Mhm.
That I feel like it would be best if we would meet the people on the lower, that like Amy says, the lower hanging fruit, meet them where they are, and then also find ways that we can get the kids who don't need as much heavy instruction, get them where they're more self-sufficient and they're able to do more things on their own, give them some things to work out that are more challenging. Why are you giving such challenging work to these kids that are already struggling every day to get through literacy assignments?
I love that. And I love hearing how you are advocating for that accommodation for your student to, and working with the teacher. And again, collaborating together so that now you have words that are appropriate for your student that can support the work that you're doing privately and also support him in the classroom and maybe elevating that teacher's awareness that these words are going to, again, I don't know about be harmful, but are not supported with the instruction that he's at and at his level or her level of learning. And so that's just a great way, again, to kind of help that teacher with those expectations, have that accommodation, which they are certainly able to utilize. So it's not that we're not thinking that spelling is important. We're just having them spell words that are at their level that they can that they can be expected to spell with the level of instruction that we're at right now.
Because the more often they're able to successfully make those connections, those letter sound correspondent connections, the more they're going to be able to transfer that over to their reading and then back to their writing,
Right.
their spelling. I mean, it just is, it's a full circle approach, and it is so much more effective for them than to just randomly give them lists of words that.
Because that's memorization, which we
Yeah, it
already
is
know.
memorization. Yeah, and because what can our kids do? They memorize. A lot of them can memorize it, pass the test. Maybe not always pass it, but at least get pretty close, or, you know, and then the next week you ask them to spell that same word, it's gone.
Yeah.
It doesn't make any sense. It does not make any sense to deliver it like that. So you're a professor, and that's just kind of throwing that out there, I realize. But what do you think needs to be done at the pre-service level for our teachers to help improve the readiness for going into schools, going into public, private, charter, whatever education? Because I think it's better. I do, because you heard me say when I went to college, it was whole language, and it was all whole language. And I walked into a classroom not honest to God, not knowing what to do. I had a bunch of sixth graders who were children of migrant workers. And I thought, oh my gosh, what do I do now? I had nobody, no computer to get on, because that was the 91. And, I didn't know
Yeah.
what to do. Do you think we are better? Are we the same? What do you think about teacher readiness programs now, as a whole?
So I always go to my mom with these questions because I was fortunate enough to be raised by an educator who has her master's in as a literacy specialist. And she always gives a great perspective, because I think, to your point and your shared or your lived experience that you shared, I think we have to know where we've been to
Yeah,
even consider where we're at, to know where we're going.
yeah,
And my mom, as an educator, talks, and she was middle school. And she was the first person to say to me, I didn't know SLPs did anything with literacy. That's so fascinating. And again, so that mindset. So she talks about the pendulum, that things swing, or I'll come to her like very excited about something. She's like, oh yeah, we did that in the 80s. Or so she gives me that humbling of that this is not everything that is new is new.
right.
So I think we've done a pretty good job. Um, I tell my students, because I think where I came in to the conversation as a professional was No Child Left Behind. And so
Right.
one thing that I talk about is there was a lot of negative experiences with No Child Left Behind. It had some very negative unintended consequences, but from my perspective as a speech language pathologist, it really shined a light on what we're doing in special education and included those kids in a way that they had never had any sort of expectation for growth in the public education system. And so I think, kind of to your point of where my mom started when she started in the 70s, and then where we were in the 80s of whole language. And then there's always this reading wars kind of comes up, or does, where are we with reading wars? I think
Yeah.
a problem that I see as as someone in higher education is a over reliance on programs right? That I, and that's, I think, our sometimes our fault, as instructors, of that the programs, this curriculum is given, and that's a, that's not a teacher problem, right? The district says you have to do this. And my mom talks about, I remember in the 90s when they gave us this curriculum, they said, this will be great. Every classroom in every school in the entire district will be on lesson 12 on this
Mhm.
date together,
Mhm.
so that every kid is getting the exact same instruction. So that mindset, again, that was great mindset of every kid gets the same thing, but that does not play out well in reality because every kid doesn't need the same thing.
Mhm.
And so I think we're doing a much better job, in my opinion, of training professionals to know the elements that are critical for success, particularly for reading. My colleagues, because I asked them in elementary education, talk about how when they were trained, there was a lot of emphasis on methods and pedagogy of like behavior, like I talked about behavior management of a classroom and
Yeah.
what we do in the classroom, and not so much what we get in our world as speech language pathologists. We have an entire class on phonological development.
Mm.
We have an entire class on language development. So there's a reason that just by training that we understand that from the birth history, case history, medical history is going to inform how you're doing academically. And I think teachers sometimes are trained, maybe you can't even ask those questions, right? Because of HIPAA. You shouldn't have access to that knowledge or can't have access to that knowledge.
Yeah.
And so they aren't thinking about how that might influence that child or that student that's sitting in their classroom. So I think we're doing a really good job with that, with teacher education. I think state standards, there's a lot of state laws on what needs to be included again at the standard level, right? We're not, I think when we get too much into prescription, that's when we take away that the expertise and the knowledge of our educators, and nobody likes to feel that
Right.
I'm not important, that this binder could do the work and anyone could
Mhm.
Right.
implement this binder. So you have to have both. But I would love to see more professional development that's relevant to everyone. And I think that this is a great space
Yeah.
for that. Again, buy-in, because again, you don't want at the table just all of the people with 30 plus years. So having everyone learn with and from one another and bringing that excitement and humility for trying new things is really helpful, and having those critical thinking skills versus and knowledge, but providing the space for vulnerability of maybe the way I've been doing it wrong, or the way I've been doing it is wrong, or maybe the
Mhm.
way I've been doing it has some elements that are right, but I can always grow. I
Mhm.
hope that kind of
Mhm.
answers your question. That's always my role.
No, I think that's really good. And it kind of made me, because I always have to biographize, always. I'm a QI, and so I'm training teachers to the therapy level. And in this last seminar, and they're used to working from a curriculum. They're like, okay, what are we going to do? And I'm like, today you are putting the curriculum aside and you're writing complete reading and spelling lesson from beginning to end based on this objective. And they're
Yes.
like, I got a lot of frowny faces. And I was like, because your goal to be a future therapist is you're on a desert island and a group of your kids are with you, you need a stick in the sand to teach them.
Yes.
You shouldn't have to be labored, but weighed down by a curriculum. You
Mhm.
should know what's coming next and how to remediate for that need. And so I kind of made me think what you were saying about that's the goal for all CALTs, really. It's not just a curriculum, but to move beyond a curriculum, move beyond a program.
And curriculums are great. I love
Mhm.
curriculums.
Yeah.
But if you're trained on the curriculum and you're not trained on the elements that are necessary, and you
Mhm.
cannot critically evaluate what pieces, like the curriculum can help be a support, particularly when you're new,
Mhm.
novice. But
Yes,
if you're
yes.
not able to be agile and adapt, or be able to articulate to a parent or colleague, or even the student, like if you want buy-in from a fifth grader, you better be able to tell them,
Mhm.
why am I working on this?
Mhm.
Mhm.
And if you don't know that and you just say, well, because that's what is
That's
next,
what it says this, you do next. Yeah.
that fifth grader is, and that's what my mom would tell you too. And I learned really quickly because I love middle school, and I've loved your podcast talking about adolescent literacy, and we need to do a better job with thinking of this as K-12, not thinking of it as K2
Yeah.
or
Yeah.
K3. When thinking about the elements of learning to read. But I just, you're going to have to get buy-in to get some sixth grader to do what you're asking them to do. And that curriculum is no buy-in. It is you, and you can use that curriculum as a tool, but if the curriculum is driving it, as you're saying, if that's all you know to do is the scripted curriculum, and you're not able to be more agile and flexible and not only support, but articulate the elements as to why they're critical, you're going to struggle. And I remember that feeling. I remember doing things as a therapist. And I tell my students that if I didn't feel confident in it, or sometimes I'll have a slide that I've written because I've gotten it from somewhere, and I'll look at that slide now and say, do I really know what that slide is saying?
Right.
Because if I
Right.
don't, I better learn, or I need to take it out.
Right.
Right. Right. Right. Right. Right. I totally agree with, and I'm only saying right because I can't come up with a better word. But completely agree with that. And it's almost like for some folks, a curriculum is a security blanket. I mean, don't take it away
And I
from
get
me.
that. Yes.
Because yeah, and I get it. And I totally agree with what you say. When you are first starting off, yes, you need to understand, you need that curriculum for the understanding of the structure and the order of presentation and the scope and sequence and all that. You need it for that, but start to let go a little bit in order to be more prescriptive.
Yes. And I tell my students that, you're talking about being a professor. When I walk in the class, I say, I know you're not going to like this, but I just have to warn you that everything that you're going to learn in this class will probably be obsolete in 15 years, particularly my class on hearing loss, because the technology is
Yeah.
so rapid. And the same with the science of reading, like our understanding of reading and how the brain works when learning to read is just moving at lightning speed. So I say, everything you learn is going to kind of be obsolete. What I'm teaching you is to critically evaluate the knowledge that we have, to know where we started, how we got here, so you will have a roadmap for being able to understand as we go forward. And I tell them, you're the ones moving us forward. So that's what I'm trying to instill in them in that course, because what I teach you, I hope you're not using the strategies as they're taught today 10 years from now, because if you are, I'm not doing my job.
That's a good
Exactly.
point.
Exactly.
Okay. So it's going to be a little bit more, we've done some really in-depth talking here.
Yeah, we have. Oh my goodness.
I
I'm going to go a
know.
little bit more. I know we're running out of time, but I want to go a little bit more kind of quirky. Are there any snake oil myths in communication sciences like there are for
Oh
dyslexia?
yeah. Oh yeah.
Like we
Dyslexia is
have,
loaded with it.
yeah, we got a lot of myths. So I've recently heard that if you get your tongue tie clipped, if you had a tongue tie that is impeding your speech development, if you get that clipped, then maybe you'll become a better reader. Is that true?
Wow. So that's an interesting one. I think that kind of, so yeah, there are definitely some myths. I think the first myth I'd like to dispel is that SLPs have no place in literacy intervention. That is a myth. For sure is in
That's a good one.
our standards, our roles and responsibilities, in our accreditation, and certainly have the training, because as we talked about too, language is the foundation for literacy. So when you're talking about speech to print, we're right up there in the mix.
Right.
For tongue tie is so interesting, because that in and of itself is just a hot topic. Do you clip? Is it, what are the benefits? Is it a thing? Is it not? I think talking about developmentally, so no, I can't say that there's any evidence to my knowledge that is that direct causation or even a correlation. If you get your tongue clipped, you will be a better reader. That just is such a far stretch as far as like a causal statement. I can't imagine that there's any evidence. There's none that I know of, and I'd be hard pressed to think there is some, but I'm going to give it a good search here to back that up. But what I will say is that it's not that we have structure and function. We talk about that a lot
Mhm.
in speech language therapy, that you cannot fix function if you don't have the structure. So with kids with hearing loss, if you are expecting them to use listening and spoken language as their primary mode of communication, they have to have access to sound. So they have to be using hearing technology, obviously, because they have a hearing loss. They can't do
Mhm.
that on their own. They have a hearing loss, so they have to be utilizing technology, whether it's a hearing aid or cochlear implant, behind the bone anchored hearing aid. Some sort of hearing technology is going to get them access to sound so that they can use listening and spoken language to communicate. You have to have the structure. So with articulation errors, not necessarily phonological processing, but with articulation errors, you have to have the structure of the speech mechanism in order to have the function. And that starts with breast support, right? So you have to have good breast support in order to then have good vibration with your vocal folds, in order to be able to move the muscles of the mouth, in order to constrict that air in the way that we're trying to constrict the air to make speech. So co-articulation. So all of that structurally has to be there in order to have the function of speech. And tongue tie is one of those structural things that if you do have a constriction in tongue mobility and movement, first of all, what we're more concerned about, particularly for the newborns and infants, is feeding and swallowing. If
Yeah.
you can't coordinate suck, swallow, breathe in order to efficiently and effectively either use a bottle or nurse at the breast, you are going to have real big problems real fast, right? If we're not getting the nutrients. So we need the nutrients. And if there is restriction of the tongue, then that's why we would want a clip so we have that mobility, so we can have that motor planning of suck, swallow, breathe. We don't want them working hard in order to express milk, either at the breast or from the bottle. And neither is better. So for literacy, again, you're just taking that road from where we start to where we go. If there is a restriction of the tongue that's not necessarily impacting them with feeding or swallowing, but is restricting them, and you see it a lot less, right? With articulation, then they're working harder for those motor planning processes. So they're working harder for that. So there's more cognitive load to coordinate the muscles if there is restriction of the tongue. And so then, you could take that down the line and say, well, there might be a reasonable argument that 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 difficulty might then carry over into now we're trying to take those speech sounds to literacy. I just think that's a stretch. I think that that's gonna, if you even saw evidence of that, I just can't see it being a huge, like, critical mass of kids who are having this problem. But it would make me wonder, not causation, but we're not tracking or even looking at those medical histories of kids. So we don't even know, right?
Interesting.
We don't even know how many kids with dyslexia have a clipped tongue or don't, because we, in the academic setting, we don't necessarily have access to those medical records, and no one's even asking the question or paying attention to who had that done in infancy. And what I've learned about restricted tongue and tongue tie is, why is it coming up today? Why are we hearing so much more about it than we did? Well, one rationale that I've heard in our field is because there was so much more bottle use in the 70s and 80s. Which I don't remember, but my mom talks about how she was an anomaly with her friends for being someone who breastfed her babies. That was just not something that was done in the late 70s, early 80s. So, that shift in what's going on in society is then shifting. Well, we're seeing more problems with tongue restriction. Well, it's because it is more difficult from the breast than it is from a bottle. So
Interesting.
And when it comes to tongue restriction, you're going to see more, not that it's more difficult, but you're going to see more impact with that restriction than you are bottle, because there's just so many ways that we can, there's so many bottles out there. If you haven't had it in a while, it's quite overwhelming. So that's that's a long answer to that. But again, it just goes back to what we talked about before, that there's so much there that is, we're humans. It's the human condition, and it's all interconnected in a way that we've kind of tried to isolate in a way that's not facilitating our understanding of the whole person and all of their development.
Fascinating. I really like to hear that. I mean, I'd say it's kind of snake oily, but it just was interesting when I heard this recently, and I was like, I would just love to hear your take
There's
on it.
no
So
way.
thank you.
It can't be like that directly. Like, if you cut, then you'll be a better reader. That
Yeah.
that is not a thing.
Yeah.
Well,
Yeah.
thank you.
That seems to, if you do this, then this will happen. You know, it's never a straight line,
Yeah.
you know. That's my feeling. So, I know I'm watching the time, but I have a question here. Can you share with us your study that evaluated child-centered play therapy for at-risk students? What were the measures? What were the results? And how do you think we can start implementing play back into our school day?
Oh, I love play. So that was a really interesting study that I again was part of an interprofessional team. So the play-based therapy is child-centered play therapy is um, counselors who are registered play therapists. So it's an extra certification that counselors can receive, where they can use play therapy as a tool for working with their kids, specifically with trauma or behavior. And so that study was really designed to see as a preventative model for kids who were at risk in these areas. And we used a protocol that the teachers completed, and we were looking at task orientation, social skills, how they worked with students, assertiveness, and assertiveness, aggressiveness. And so looking at these areas, the teachers, if they were at risk, but they weren't showing overt signs of aggressiveness that needed an immediate referral, then they were given therapy, play therapy from counselor interns. And then our students were doing a lot of the data collection. And of course, I was part of the team that was looking at the play therapy, because I wanted our students to see how counselors use play. It's very different. So for registered play therapists, they have a room that's very intentionally filled with different types of toys. So they'll have like a sandbox or some sort of sensory area. They'll have toys of aggression like swords or hammers. They'll also have a play dollhouse with little people. So they have the little people manipulatives. They'll have art crayons that they can play with. And they just are allowed to play in however they want. And that play is their language to work through their behavior, trauma, if it may be newly diagnosed with dyslexia and how they're feeling about that. And so they're just in this room playing. Whereas with speech therapists, the way we use plays is a little more directive, right? We have our goal and objective. We want our area to be very cleared of any distractions, and we bring in our toy that we're going to use, because we're going to use that toy to hit our target goal: receptive, expressive language, articulation, literacy, whatever, written language, whatever it is. We're using those toys very specifically, and they're allowing the students, counselors, to use them to show a window into how they're feeling. And I've seen this work, and it's fascinating to see how much expression you can get when you just follow their lead and allow them access to all of these different types of manipulatives to use as their opportunity to express thoughts that they might just not have the vocabulary or the language to be able to express. So that, I think, is a really neat piece. Again, going back to that interprofessional education and practice, understanding the function of counselors and how they're using play as a tool in a very different way than we would as a professional. But so the outcome was, after these students received play therapy, we saw marked improvements in all areas, right? So that, and this is teacher perception, and the teachers knew, of course, they had to know who was involved in the therapy as well. So there were some limitations in how we collected the data, but the understanding of having those kids be able to talk about and communicate what was important to them and what they were struggling with, you saw that the teachers at least perceived there was an improvement in task orientation. There was a decrease in their assertiveness. There was an increase in their positive social communication and interactions with their peers. What I found, and this is another piece that I added to the study, was I asked the question, how many of those students because we screened all second graders in one school. I think there was like 150 of them. I can't remember the exact number, but how many of them who were screened had an IEP for speech and language? And then how many of them qualified? And what we found was almost all of them, 8 out of 9 who had
Wow.
an IEP for speech or language qualified for the services. So they were at risk for these adverse behaviors as
Mm.
identified by the teacher, and also had, and we didn't distinguish between articulation or language, but they didn't have any other additional diagnosis. So they weren't in special education services for as the primary for autism or intellectual disability or any. They had no other diagnosis other than just speech as the primary. And so it just kind of, to me, shows we need to have the counselor involved in the conversation as well.
Mhm.
At that school, we were meeting the counselor, the speech language pathologist at the school, and then our team from the university. And the counselor was not going to the special ed meetings. After this project, she started attending those meetings and was like, oh my gosh, I can't believe how much overlap there is from the students that are on my radar in
Mhm.
counseling that are there with IEPs who are being seen for services. And I thought, well, yeah. And she just started being part of the team. So just being part of this study, we changed the culture of that school because that counselor saw her added value to those special ed meetings, but she never saw herself as a special ed because that she's not identified as such.
Right.
They're not in that IDEA. They're not considered that group. And so she wasn't attending those group meetings. And we just had this barrier that just did not need to be there. And so that school now has the counselor involved in all of those conversations. And they saw the overlap in these kids are at risk. They're already in speech path. And so the speech pathologist started meeting with the teachers of those kids because they were the ones at risk from a higher proportion than the general population of second grade students. So to your point, Melissa, we're identified. I mean,
Yes.
if they're on our radar, maybe they're just garden variety articulation. Maybe they just have a little bit that we need to work on. Maybe they're just fluency, but there's just so much more going on. It's so much more complex than that.
Yeah. And you're it's like your dream reality coming true, that
Right.
all of these different people are involved, and then more people know what's going on with that child so the child can get the services that they need.
And
It's
we're not
ideal.
So,
doing more as professionals. We've been able to coordinate and extend, so we're being just more efficient.
Right.
so I'm making notes here, and here's my table. Who should be at the table? The SLP, the counselors, the diagnostician, of course, the parents, the current classroom teachers, and the past classroom teachers to give that full
Oh.
picture of everything that's because I was listening to you talking like, yeah, that'd be good. Oh, counselors, yeah, that'd be good, and I'm that really should be who's at or IEP meetings or ARDS or IDEA meetings or whatever we're calling them to give that full broad picture of that child, of how they develop, past development, how they've done, how they're doing now, and how we can support in the future.
And I
Mhm.
just think about your reach as a QI. What if just one thing you asked those in your meetings, if you said name one of these people and interview them or just
Yeah.
ask them, ask them a question of curiosity that you have about them as a person and as a professional.
Well, shoot, I have to update my syllabus now.
I mean, that takes like, yeah, it doesn't even have to be a learning outcome. It can just be
Yeah,
just a curiosity.
yeah,
Do you talk to these people? And if not, shoot them an email and tell them that you're interested in them.
yeah, yeah. No, I think it's
It would make such
wonderful.
a huge, and it takes all of us to do these things.
Mm-hmm.
We can't just make a change state level because we know the states don't listen to us as educators.
Mm-hmm.
We have to be the ones fighting on the ground, making the differences amongst ourselves. And of course, we'd ideally make changes statewide, but that's going
Yeah.
to take a lot more of us to know what needs to be done and forcing that hand,
Mm-hmm.
in my opinion.
I
Wow.
agree. I just feel so energized hearing your stories and lived experience and the things that you guys are doing. Again, it just like we teach and you teach as dyslexia therapists, right? Explicit, intentional, constructivist. It's the same thing.
Mm-hmm.
We just have to be a little more explicit and intentional in our coordination of services, and then we'll have that bigger reach to be able to extend.
Yeah.
Mm-hmm. I love it. Okay, so Amy, do you want to ask your question
Yeah,
first?
I'll ask my question first. So,
Okay.
you told us at the beginning who you are and things that you've done. Now, this is Dr. Bauer's personal list of things. What books do you recommend? It could be your own, that's fine. Articles, websites, people who inspire you. What would you recommend to others?
Well, as I started with, you guys have already had a lot of the textbooks. So the textbooks that I require for my class, you've had the authors on your podcast. So I always have my students read Overcoming Dyslexia because that one's really, I think it's geared for parents. It gets them out of a textbooky. I always have them read a memoir that they get to choose. So I have a list of memoirs because again, I think that lived experience is so helpful for them to remember. If you are someone who's never had a diagnosis of any of the disorders, and I hate calling them disorders, I really hope we move away from that, but
Yeah.
part of the human condition that needs some additional supports from experts, then I think you just have to listen to their voices. So that's where I encourage people to go. Our um, professional governing body, ASHA, American Speech Language Hearing Association, I think is a great resource for that would cross-pollinate a lot of the things that are already happening out there with ALTA and some of the organizations, MSLEC. ASHA is a
Mhm.
great resource. They have a a lot of resources, but they also have what I like that is where if you're looking for articles, they have a search engine that really
Mm,
assists with that. And so I have all of my students use it. It's a free resource, so you can put in, and they have learning modules or kind of brackets for what areas, and they have literacy as one of them. But you can also go and look for if you've got a child with a cleft palate repair, right? That also is having literacy issues. Well, probably because they did not have the structure, so it was hard to get the
yeah.
function. And then once they might have had the repair, maybe they do have some outstanding difficulty with those connections between speech sounds and orthographic patterns. So if you have clients on your caseload that have some of these additional disorders, Ash has got a really good um, mechanism on their website that you can look up by disorder and kind of see some articles and some information that can be a little bit more specific for that population. And you can put in you can put in literacy and cleft palate
Mhm.
or, any item, and it will, instead of Google giving you, 2 million in 0.5 seconds, which can be a little bit of overload, it's a little bit more curated.
Not to
I
mention,
know.
a lot of the Google articles you sometimes have to filter through what you have to pay for and what you don't.
Yeah.
So,
Yeah.
Yes. Yes.
I,
Exactly.
I know that ASHA is also part of in the Alta, if you look on for the membership side, they take CEs from a lot of the ASHA or
Yes.
organizational things. Yeah.
Oh, I love that. So you can find some of those
Mm-hmm.
resources that would also count for your continuing education
Yeah.
units.
Yeah.
We work hard on our end when we do any professional development to make sure that we have ASHA and then also special education through, I think, Council of Exceptional Children, I think might be the one
Mm-hmm.
we use. So we try to make sure that we have those supports as well. And I'm lucky because um, we have many people on our staff here at the University of Arkansas. So we have a QI in training who's also a clinical instructor. So I think that piece is really helpful too, to kind of just have those connections with the supports that we're providing. Supervisors, I try to get away from the academics is one thing, clinical education is another. Like it's all the same thing. And then our community partners who are our community preceptors who are also providing that valuable instructional piece. We're all on the same team,
Yeah.
going back to collaboration. So just you don't even have to be different fields. That education piece really needs to be coordinated as well.
Nice.
Um, so yeah,
That sounds great.
I think you guys just provide such a service, and I'm so thankful that you invited me to the conversation and invited the speech language pathologist perspective, and that other people might reach out to their SLP who are your audience, or maybe now your audience will grow and have more SLPs. I don't know, maybe they're already out there. So I love
I
that.
hope so.
I learned so much. I've always been intrigued by how speech interacts with dyslexia interventions, and I am so thrilled to learn as much as I learned from you. I didn't know all about how birth develops, how everything develops all through birth and everything. It just is so fascinating to me. And I think about how, oh my gosh, what if something went wrong in developmental phases in, the infancy that led to this
Mhm.
development later? Or was it because they were born, they had the neurobiological um, deficit to begin with, and that's why their mouth didn't develop properly? Like, it's just, I don't know. My brain is just spinning right now with all the possibilities of what it is and what it could be. And I know people like you are way smarter than I am. So I look to you guys to tell me all of the information.
Well, I think that's just where, again, when we value each other's training,
Yeah.
SLBs are never going to be the dyslexia therapists because we're not dyslexia therapists necessarily. I mean, but unless we specialize that way, right? And so kind of get our master's degree and then go that direction and say, this is what I'm going to specialize in addition to being an SLP. But we do have that, right? That training across the lifespan. So it is helpful when you don't need to know all of that. Because you can use your SLP as the resource to kind of walk you through that for
Mhm.
individual and learn the pieces that are relevant to what you're doing in dyslexia therapy.
Yeah, it's wonderful. I'm glad that we had this opportunity to learn from you, and I will definitely be reaching out to more speech therapists who share students with me. So thank you.
Like the best outcome. I love that.
Yes. Okay, so here's my magical question. I
It's a
call it the
magical
magical one.
question
Magic.
for sure.
Okay, so if you had one wish that you could grant for our students, what would it be and why?
Are we talking about students who are diagnosed with dyslexia, like your
Either
kiddos?
diagnosed with dyslexia. I know you have students who you see in a different way. I know you have
Or maybe even
students
that
going through
overlap.
college, or yeah, the
College student.
overlap, anything that
Yes.
you feel like whatever your student is that you want to reach.
I know.
What
I
would you
always
do
think
for
about
them?
that because we've got the K-12, and then we've got higher ed, and then I consider myself a student. I'm a
Yeah.
lifelong learner. I'm learning right now. I feel like a student from you guys, and even preparing for this and listening to your podcast. So I think we're all students. So I think that's one thing that I would say. But one thing I would wish for them, and what I wish for all of us as we are in this together, is that we see ourselves as lifelong learners and that we're all continuing to grow and develop, and that development doesn't stop. And so what we're providing to K-12, well, and to the point of like the show. What's happening in birth to 5 for those learners is influencing K-12, which is influencing how we contribute to society, whether that's going right into the workforce or getting some skills through training in trade school, or going into higher education to learn from a college environment. Whatever that is, that progression, we're all part of that developmental process and lifelong learners. And so as part of the human condition, I always wish that I had seen myself that way, my younger self. Like, I wish that on my younger self. I wish I had more grace on my younger self. And so I try to provide that as we're all moving through this thing, human condition. And I'd love to see our mechanisms for our kids treat them as part of the human condition and not disordered, different, delayed, deficit.
Yeah.
But also maybe not necessarily special. Like, we're all just people, right? It's not like I'm not highly specialized because I'm blah, blah, blah. I'm just me. And you're just you. And we're just all doing this thing together. And so I wish that for our kids. I wish that for every 6th grader, that they just knew this is part of the human condition, right? And whether you have dyslexia, or whether you need differential instruction in another way because the classroom doesn't provide that for you, and you need additional support because you're advanced from what the curriculum is given. Like, all of those are unique and valued collectively. And I always wish that for my students. Kids with hearing loss, the same, that they just feel part of that connection. So that's my wish, kind of, for all of my students in college, my own kids. I think about that for them too. So
That's beautiful. That gave me chills.
Oh.
It really did. Thank you for that. I love that insight.
That's wonderful. All right, so we're going to go ahead and sign off. So this is Amy,
And Melissa,
and we're the Dyslexia
Dyslexia Duo.
Duo. We'll see you next time. Thanks, guys.
Bye.
Thanks.
Bye.
I loved
Okay.
it.
Okay, so
Appreciate it.
Lisa, so do you mind?